Okay, now we start recording. Would you like to do the opening for
Oh,
us?
yes,
Yeah,
yes,
sure.
yes.
Okay.
Yeah, so hi everyone. Today is our honor like to see also dear again ICC member and their colleagues also around the world. Today we had a distinguished attendance from Vietnam and she will give their presentation to us about the early attendings, especially in the clear aligner therapies. First of all, I would like to introduce Dr. Charlie Su. Today he will join us as a co-moderator. It is a special edition to have him to join us today. And he's the faculty of the Chang Memorial Hospital. Hi, Dr. Charlie.
Hi, hi, hi. Thanks for your introduction. So unfortunately, PY and Junior are unable to join us today. So I'll have to first I'll have to introduce our panelists. So today we have three good friends invited as a panelist. So the first panelist is Dr. Pirapong Santiwong, head of the orthodontic department at Mahindo University, Thailand. He's an accomplished researcher and innovator, recognized with the 2022 Prime Minister's Trip Award and Gold Prize at the Seoul International Invention Fair. And hi, Dr. Santi Wong. Would you want to say hi to our audience?
Yeah.
Yeah.
Hi
Hi.
everyone, and thank you for having me as one of the panelists.
Yeah. Okay, let's continue to our second panelist. She's Dr. Swanti Acharya. She's head of the dental wings at IMS and SUN Hospital, India. She's an orthodontist specializing in cleft and craniofacial care and is actively involved in several international professional societies. So, Dr. Acharya, are you here? Oh,
Good evening, everyone. Thank you so much for the lovely introduction.
yes. Thank you. Okay, and our third panelist is Dr. Jimmy uh, Chi Chun Tsai. She's the president of the Taiwan Association of Aligner Orthodontics. He's a board certified orthodontist with expertise in fixed appliance, clear aligner, and orthodontic education. Please say hi to our audience.
Hello, I'm Jimmy from Taiwan. Nice to see you, everyone. Thank you.
Okay, Dr. Prayer, please.
Yeah, thank you so much, Dr. Charlie, for your introduction to all the panelists. So I would like to introduce our speaker today to everyone. Dr. Trang Ho, she's the leader figure and pioneer in Vietnamese orthodontics. Dr. Trang currently serves as the head of orthodontic department at faculties of dentistry, universities of medicine and pharmacy in Ho Chi Minh City and is the president of Ho Chi Minh City Associations of Orthodontists. With nearly 30 years of clinical and academic expertise, Dr. Trang is an internationally recognized educator and researcher. She has authored over 25 articles in national and international journals, alongside several definite orthodontic textbooks. Her extensive lecture topics span from craniofacial growth and early childhood interceptive attentives to complex class 3 malcocclusion and clear aligner therapies. As a proud member of AAO and BFO, she continues to shape the futures of dental educator and clinical excellence. She will give the presentations on the topics of its aligner treatment feasible for children. Please join me in giving a warm welcome to Dr. Trang Ho. Welcome, Professor Trang.
Okay, thank you. Okay, good evening, everyone. Thank you so much for inviting me, especially Professor Pan Jun Choi for inviting me and to join a ICC webinar and also give me this opportunity to present this topic tonight. And I really thank Dr. Brea for connecting me with ICC for a long time. At the beginning, maybe for several years, and take time with me for this webinar also. And thank you, Dr. Shirley Chu and Dr. Claire for moderating this webinar tonight. And also thank you all the panelists, Dr. Chan Ji Wong, Dr. Ashavia, and Dr. Jimmy Chung Thay Chai for joining the panelists for this webinar. And good evening for everyone on the participant today. I will start my presentation with the topic is clear aligner treatment visible for children, and I have no conflict to interest to declare. And these are the contents of my presentation. First, I have a short introduction about types of orthodontic treatment, and then what is remarkable for orthodontic treatment in children. And then I will show some case with class 3 occlusion treated by clear aligner and some class 2 cases. And finally, conclusion. And firstly, how many types of orthodontic treatment? There are several types. There are 5 types of orthodontic treatment: preventive orthodontics, interceptive orthodontics, comprehensive orthodontics, and orthodontic surgery, and finally, adjunctive orthodontics. So, preventive orthodontics involve maintaining space for eruption of permanent teeth and eliminating oral habits. And also, interceptive orthodontics is indicated in children having skeletal discrepancies, functional shift, or eruption disturbance. Comprehensive orthodontics is provided for adults or for children having permanent dentition to align teeth, to improve dental and facial aesthetics, and to establish stable occlusion. Orthodontic surgery is indicated for adults having skeletal discrepancies that cannot be managed by orthodontics or treatment alone, or for children is seeking for significant improvement in facial aesthetics. And orthodontic treatment facilitate for prosthesis, periodontal or occlusal treatment. This is called adjunctive orthodontics. So, how about orthodontist treatment in children? Who are children? Children are immature persons. According to UNICEF, children are any person under the age of 18. And according to this diagram, how many types of orthodontic treatment for children? There are 3 types: preventive orthodontics, interceptive orthodontics, and comprehensive orthodontics. So what is remarkable for orthodontic treatment in children? We know the growth shaft. So children experience their growth spurt that strongly influence both the treatment diagnosis and treatment planning and treatment realities. And you know that growth spurt differ between boys and girls. In general, boys experience their growth spurt later than girls, and their peak growth velocity is higher. And also, the muscular and mandible also undergo growth spurts during this period, significantly influencing the timing and the outcomes of the treatment. So, traditional treatment options can be used in children, such as habit-breaking implants for preventive orthodontics, extra-oral and functional implants for interceptive orthodontics, braces for comprehensive orthodontics and interceptive orthodontics with auxiliary like elastic or temporary anchorage device. So, can clear aligner handle on this type of orthodontic treatment? We know that the article in 2000 2022 show that using a clear aligner treatment using in children lack a large of evidence, but it is proven to be an excited field. And essentially, this year, the article into 2026 showed that clear aligner treatment has progressed to be a dominant modality in contemporary orthodontics. However, to enhance evidence quality and patient outcome, they propose a stronger research design. And before going to some cases, I talk a little bit about malocclusion in children. Malocclusion in children may result from skeletal discrepancies, including anteroposterior discrepancies or transverse or vertical discrepancies. It may result from tooth arch discrepancies, like including crowding, spacing, abnormal dental size, and dental shape by protrusion, or maybe result from eruption disturbance, like ectopic eruption, missing or supernumeral tooth or impacted tooth. So I will present my clinical case in two categories, class 2 and class 3 malocclusion. Although my cases also include other types of malocclusion, such as vertical or transverse discrepancies, crowding, spacing, ectopic eruption, and missing teeth. And how clear aligner treatment is. The article also show into 2019 one case report using clear aligner for treating class 3 malocclusion in 11 years old girls. And last year, 2025, one case report also used to treat class 3 malocclusion using clear aligner combined with face mask. So, can clear aligner used to be correct these class 3 malocclusions or improve the class 3 phases? And class 3 malocclusion can be classified into dental, skeletal, functional, or combination of these types. And this is the first case of class 3 malocclusion. This girl is 14 years old, and her mom come to see me with the shape plan was to correct her crossbite, not her face. And this is her obesity and herself. And the patient was diagnosed class 3, skeletal class 3 with hyperdivergent tendencies. And the vertical cervical vertebral at stage 5. She also have a crossbite and spaces on the lower arch. So what is the objective? What was the objective of this patient, and what is the treatment plans? And this is my treatment plan on the clean check. For the patient, my objective is to correct crossbite. In order to correct crossbite, I into the low incisor and retract the low incisor. I also add lingual root top on the lower incisor and use class 3 elastic. And after first set of aligner, and this is the occlusion and the teeth after first set of aligner, and the lower teeth not aligned yet, I need the first set of additional aligner to correct it. This after first set of additional aligner. The set before and after treatment. And here's the supporting positions before and after treatment. of her face and her profile after treatment. And after treatment, yeah, we can obtain the objective. Her gross bite corrected. Class 3 canine obtained, and also the teeth aligned and the occlusal settle. And this is the second class 3 patient. The patient, a girl, 10 years old. Her mom wanted me to improve her profile, face, and her gross bite. She had a COCR discrepancy. It's her obesity and her sex. So the patient was diagnosed a dental and functional class 3, and she was a cervical vertebral stage 3. She had gross spine, spaces on the lower arch, crowding on the upper arch. She have a concave profile and protrusive lower lips. What is the objective? What are the objectives for this patient, and what I can do for her? For the patient, I want to correct the gross bite. That is the primary objective. So to correct that, I align the upper arch, upper teeth, align the lower teeth, and retract the lower teeth to correct gross bite. Then after first set of clear aligner, the bite jump, the teeth align. And her set before and after first set of aligners. Her profile before and after first set aligner. And these patients are in the treatment. I'm waiting for the complete eruption of the second molar and to start the first additional aligner to settle the occlusion. And the third class 3 patient was a boy, 10 years old. He had previous orthodontic treatment with face mask at age of 7, but because he have no result, so his mom stopped the treatment until he was 10, and her mom wanted me to improve his profile, his face, and also his occlusion. He has COCR discrepancy. This is his obesity and his sex. So the patient was diagnosed class 3 skeletal and functional class 3. She was at CV stage 2. He has a gross bite, spaces on the lower arch, procline upper incisor, and upright lower incisor. He had a concave profile and protrusive lower lips. Was in mixed dentitions. What was the objective of the patient, and how about my treatment plan? To correct the gross bite, I use inkling plan in 3 weeks to jump the bite. And after that, I scan and do aligner for correcting the gross bite 1, 2 to 2, align the teeth, align the upper teeth and lower teeth, open space for upper canines, and retract the lower incisor.
Sorry, Dr. Chang, could you please adjust your microphone volume because audience feels it's not loud enough, please.
Really? Really? Sorry. Can you hear me loud enough?
Yes.
Can you?
Yeah, I can.
Yeah. Okay, sorry for that.
Okay, thanks.
So so this is the first set of clear liner. And after first set of clear liner, and this is his occlusion after first set liner. And this is the step before and after first set of aligners. Now, it's patient still on and his profile before and after first set aligner. Patients are in treatment and are still waiting for all the permanent erupt, then and then start the second additional aligner to settle the bite and to close all the space on the lower arch. So how about the aligner treatment for class 2 malocclusion in children? The first patient of class 2 malocclusion, he was 13 years old, and her mom wanted to improve his chin, his profile, and his bite. It's safe. This patient have a reduced chins and had hypodivergent tendency, and he was at cervical vertebral stage 3. He has acute nasal labial angle and mental labial angle. Have a deep bite, 100% deep bite, a mild crowding on upper arch, and spacing on the lower arch with 2 teeth missing, 2 incisors missing. On her set, we can see the upright of upper incisor and also lower incisor uprighting. What is the objective of the treatment and what is the treatment plan for him? For the patient, an objective is to correct the deep bite, to open space for 2 missing teeth on the lower, and then to procline the upper and lower incisor. And after first set of aligner, the lower incisor is still not aligned. I need to do an additional aligner to correct that. This is after the first set of additional aligner. His set before and after treatment, and his teeth before and after treatment. His face before, after, and during the follow-up. His profile before, after, and follow-up times. See an improvement about not only the bite, also his profile, the chins also. And the second class 2 patient, she was 11 years old, and the main concern was the protrusions and crowding. And his OPG, her OPG. and herself. This girl was diagnosed as a class 2 skeletal with hyperdividend tendency. Cervical vertebral at stage 3, between 3 and 4. And she also have a class 2 dental open by the over by 50% and overjet 7 millimeter. She have a severe crowding on upper arch and lower arch and proclived lower incisor. She have a convex profile and have a protrusive lips, upper lips and lower lips. She was an dentition. What is the objective of the treatment? And how about the treatment plan? Do we need extraction or non-extraction? This is a treatment plan on the clean chat. And for the patient, I to extract two first premolar on the top and two bi-premolar on the lower. Two second premolar on the lower. So I also use spade to align tests on the also use elastic on this case. So after first set, a liner so primary test closing and to still have a spray there. So I need to do additional liner to close spray and to align on the teeth. After the first set, additional liner, still have some problem, still not lie on the lower incisor and also a bit on the upper incisor. So I need to do an additional liner, the second additional liner. And after the second additional liner, the teeth align. So the teeth before, during, and after the treatment. OPG after treatment. The step after treatment. In position before and after treatment. The phase before, during, after treatment and follow. And her profile before, during, after treatment and follow. The third patient of class 2 malclusion, her mom complained about her protrusions and her crowding also. OPG and herself. This patient have a class 2 skeletal, the problem of the mandible. He had retrusive mandible. She also have a hyperdividend tendency and several cervical vertebral at stage 2. She have a convex profile, acute nasolabial angle, and biprotrusive lips. She also have a dental class 2, deep bi, and a large overjet, 12 millimeter. She also have a crowding on upper arch and lower arch, and prolonged upper and lower incisor. What are the objectives of the treatment? And how about the treatment plan? Do you need extraction or non-extraction for this case? And this is my treatment plan on plain chat. I do this case with the instruction. I widen brow of the upper arch and lower arch to align teeth, and then I give glass to elastic for correct glass to. And this is after first set of aligner. The patient didn't wear elastic, so we see we still have a glass too. So I did an additional aligner to correct it and to align on the teeth. But when we have a second set of aligner, the patient don't want to start to continue this treatment. Didn't want to continue the treatment, and after 1 year stop the treatment, the patient start do the treatment again, and then she go abroad for studying, and after she returned back Vietnam in summer 24, the teeth like that still have a glass tooth, still have a glass tooth, but on the right side. So I did another additional liner for her. And after 1 year's treatment in July of 25, I can already get glass one outside and well line. So I decided to start the treatment, let her wear retainer. And her OPG after the treatment, herself after the treatment. Herself before and after treatment. After treatment, musculoskeletal corrected, and also the procline of upper and lower incisor was corrected. And superimposition before and after treatment. And her bite before and after treatment. Class 2, 10 to class 1, deep bite corrected, and reduce the overjet reduced, and also the upper teeth and lower teeth aligned. And then this is the photo before, during, after treatment, and follow. See the big change, the significant improvement in her profiles after treatment. The four patient, class 2 patient, this boy, 12 years old, mom wanted to improve her profile and improve her reduced chin. His bite is OPG and his set. So the patient have a class 2 skeletal, and she was at CV stage 2, between 2 and 3. He have a reduced chin, and he has acute nasolabial angle and mentolabial angle. He has class 2 dental, deep bite, the large overjet, 10 millimeter, minor posterior or crossbite, and has spaces on the lower arch and crowding, mild crowding on upper arch. On self, we see they have a procline upper and lower incisor. What was the objective of the patient and have a treatment plan? Need to extract or no extraction? And this is the treatment plan on clean chat. For the patient, I round up. On the patient, I round up the arch and lower arch, and then The patient area of widen, expand the upper arch and lower arch. Then I use MA feature of Invisalign to jump to correct the class 2. So after first set of aligner, I improve, class 2 improve, class 2 improve. Little bit, need a little bit more to align the upper front teeth and use additional aligner. And this after first set additional aligner. And his OPG after first set of aligner. He said after treatment. He said before and after 1 year of treatment. Class 2 skeletal corrected. And the procline of upper and lower incisor corrected. Teeth up more upright. He said before and after treatment. And his profile before, after treatment, and follow. You see the big improvement of his profile. The chin improved a lot in more than 1 year. And the article show that orthodontic treatment of class 2 malocclusion with clear aligner, you can use the mandibular advance of class 2 elastic. They also have a significant improvement of mandible the chin. And also another article on 2026 show that predictability of clear aligner in achieving dental arc expansion during misdentition, and show that predictable of expansion in the muscle was 65%, and expansion in mandible show high predictability, peaking at the deciduous canines. And Invisalign first demonstrate modest to moderate predictability for dental arc expansion in misdentition, particularly in the mandible arch and anterior teeth. So the last case, class 2 case, he was 8 years old with the sheep complaint about atopy eruption of 2 lower incisor 32 and 42. He also reduced chins and a deep bite. And he said, and his OPG. The patient was diagnosed as class 2 skeletal, reduced chins, and CVS, CV stage 2. He also have a dental class 2 atopy eruption at 32 and 42. He also have a deep bite. He has an upright upper incisor and lower incisor, and in misdentition. We need to do to treat this case, and what are the options? And this is my treatment plan. I want to correct the atopy eruption of 32 and 42. So I want to expansion the upper and lower arch for align the teeth. I have a space for align lower incisor and also align upper. Then I use MA to correct class 2. And after first set of aligner, the lower teeth align, the deep bite correct, Class 2, correct? So is after first stage of treatment, we wait for all the permanent erupt, and then we settle we settle the occlusion. It's OPG before and after the first stage of treatment. Is safe before and after first day of treatment. And his slide before, during, and after first stage of treatment. And his profile before, during, and after first day of treatment, you see the remarkable improvement of his chins, his profile. So I have some of conclusion. Firstly, clear aligner can be used to treat malocclusion in children. And secondly, traditional face amendments, the objective of clear aligners are to achieve both aesthetics and function outcome, including attractive smile, improved dental and facial aesthetics, and also stable functional occlusion and healthy periodontal and TMT. And I think with aligner, we can create a confident smile for children. Thank you so much for your attention.
Okay, thank you, Dr. Trang, for this very amazing talk. And before Q&A, we have a panelist discussion session. And first, we would like to invite Dr. San Thi Wong. Do you have any comments or experience to share with us? Please, Doctor.
Okay. Thank you, Professor Tang, for sharing with us a very beautifully treated cases. And I think my question to you is, the first one is about the compliance. Because everything we discuss here assume that the child actually wears them, but the evidence is that the pre-pubertal child is quite difficult to motivate. And in a 9 years old, how do you manage that?
Yeah, thank you for your comment and thank you for your questions, for good questions. Yeah, compliance is also a big point for the treatment, especially for clear aligners. So, first thing I think is for clear aligner treatment or removal appliance treatment, the compliance very important. So before starting treatment, I need to let the patient know what is the good point and why do you need to treatment. So if a patient understand why you need to treatment and they agree the treatment, then I start the treatment. If not, I think it's need time for them to understand before starting the treatment. But if we show the case and we show the change of the face, the teeth, before and after for them, and we can persuade the kids and also the parents for the treatment. And also the parent is very important in cooperate with us to follow the kids and also instruct them and remind them for the treatment. I just do the treatment until the parents and the kids accept the treatment and feel confident, feel agree with the treatment. Yeah, that is my opinion.
Thank you. And I agree with you that the family is quite important for this issue. And
Yeah.
my second question is on the class 3 cases.
Yes.
Normally, I would separate into two things because they behave very differently. Correcting an anterior crossbite from a dental or pseudo class 3 is where I think it's well within the reach of aligners. But for the true skeletal class 3, I don't think the aligners can solve all the problems because we need a protection of the maxilla during growth period. So in your cases, are you correcting the dental crossbite only or claiming a true skeletal class 3 changes with aligners?
Thank you so much for this question. That's great question. Yeah. Normally, I just show just 3 cases and not cover all the case of class 3. Exactly like you tell that for 2 class 3, we need to do muscular projection before, not just correct the crossbite. I absolutely agree with you. Yeah, but normally with for 2 class 3, I usually use rapid muscular expansion with face mask. Or now in Invisalign we have IPE with hook. We can use IPE with hook for the first stage to protect the muscle, and then with your aligner to align the teeth and settle the bite. And you see in the last case of mine, the boy, he have a skeletal class 3, and functional skeletal and functional class 3. She have retrusive maxilla and protrusive mandible. This patient already have a face mask treatment before at another clinic, but at the year 7 years old, but no result. I think, but no result. Maybe not for the doctor. So I think for in Vietnam, some patient they can't stand for face mask just because when they sleep, they not just lie on the same position. They can turn right, turn left, and even upside down position. So some patients can't stand for face mask. So maybe in that case, we can do another option. But for this patient, because I use a clean plan first for jump the bite. And he just go, even though he was 10 years old, but he just was as CV stage 2. So he still have a remaining growth potential. So I think after the bite jump, and it creates the environment for the growth of maxilla. So that's also a point for a class 3 patient in young age. Sometimes, even though that's class 3 skeletal, but just want to jump the bite first, and after the bite jump, the muscle will grow. But it just because he's still still young still SC, VSA 2, so the growth potential still there, still have. So I think it's okay for him. But maybe another can use another option like tag. If you can use face mask with IPE with face mask, you can have to use tag or some fixed or temporary anchorage device and class 3 elastic for this case.
Okay, thank you. And the last question, actually it's not a question, but I would like to share with you that at Mahidol, we are a little bit cautious with Invisalign first.
Yeah.
For the 2 reasons, first one, the evidence isn't strong enough to make it our first line phase 1 treatment. And the second reason is the cost. Yeah, the cost is quite expensive for most of our patients.
Yeah.
So we are not anti-aligners, but we just cannot pass an unproven premium to cost-sensitive families. So when the evidence matures and the cost drops, we will adopt. Okay, thank you very much.
Okay, thank you. Thank you.
Okay, so let's invite our second panelist, Dr. Acharya. Do you have any thought to share with us?
It was an excellent presentation, madam, and the cases were really beautifully treated. I just wanted to ask you whether you do in-house aligners or you just go for Invisalign.
Yeah, thank you for your questions. Normally, I just do in-house aligner in some very simple case. For example, some relapse or some just a little bit like close pay, like that. But normally for the difficult case, complex case, I use Invisalign only.
Invisalign, no doubt, is a very good product, and I completely trust Invisalign. But somehow I feel during the finishing and detailing part, we do require more of attachments for the detailing, especially. So, how compatible and cooperative your patients are, especially these children, because they are not adults, and the treatment in adults, especially regarding the cooperation part, is much more compared to children. So, how do you manage that, madam?
Yeah, thank you for the question. Normally, when treating with children, with kids, especially for the young age, some patients lost the aligner, and some patients just wear. Sometimes just wear not enough time, but some case like a patient lost aligner. For children, fortunately, after they lost the aligner, they can move another one easily. It not it, the children, the kids normally easy. The is easy to change. We can change the aligner, and then in case they lost a liner, they can jump for another one. And also, as I told before, normally I start the treatment when the patient agreed to wear liner. We don't push the kids to do without agreement from them.
Thank you so much, madam. Thank you.
Thank you. Yeah.
Okay, and then is our last panelist, Dr. Tsai. Do you have any experience to share with us?
I got still some questions want to ask about Dr. Tang because a very excellent case and especially those severe crowding case, you can solve it with Invisalign and create all the spaces. And for those children with skeletal class 2, we all know we would like to do some growth modifications. And if it's possible to use the Invisalign MA system or even the latest one, MAOB, right? The by block.
Yeah.
Okay, comparing to the traditional maybe activators or trim block, what is your opinion between these two appliances? Is this all always works very well with those MAs or MAOBs? How's your opinions about these features?
Yeah. Most of K I use MA. Yeah. I use 1K with MAOB because
Mhm.
MAOB could just
Launched recently.
very news for us. But really, I also love MA just because Yeah, I don't, maybe that's depends on people's, but because MA is very flexible, even though some cases they can buy on that, but all my case, it's not happen for my children. So I think it's a flexible because MLB, when we use MLB, for me, for my opinion, the mind open a lot and also hard. So maybe it's that depends on the experience, depend the doctors, but I think both can use that, can okay for me.
Okay, so from now, maybe most of the class 2 modification, you use the MA instead of the traditional twin block.
Yeah,
Okay,
yeah,
thank you.
because because I also pursue the patient lot with Invisalign, with aligners, with Invisalign. Besides, we correct the skeletal discrepancies. We can align the teeth also. So maybe after the first stage of the treatment, even with Invisalign first, with MA feature and align the teeth, we can correct on in one package. So
Mm,
yeah, so even though it's the cost is much higher, but in January we can correct two a lot of it also. So maybe
mm,
some patient we can need. I don't need the second stage.
mm. Okay, thank you, thank you.
Thank you.
Okay, and then we'll continue for the Q&A section. Dr. Prayer, please.
Yeah, so everyone, if you have any question, please feel free to ask. Maybe start from me first, because the case that I saw from you, like learn from you, like a student with severe malocclusion, and then you start align. I think maybe the last case, you start aligning all the crooked ones, and then you use the mandibular advancement.
Yes.
But I saw like how to say, like you have like 70 trays. So how many days for your protocols? Because I think if like 7 days, this might take about 2 years, but during the 2 years, that gonna be like the shading of the primary teeth, and the teeth just keep changing. So how do you manage about this kinds of treatment? Thank you.
Oh, thank you. That's great questions. Yeah, 80 aligners, so a big aligners. And normally for children, I just let them wear 7 days for one aligner. So for
Mm.
the patient, he lost many aligners. I need to jump many times for this case. So yeah, so they lost one, and then I jump the next step, the next aligner, many times for this boys, the patient. So the total time, I think, because I remember that because I do the Invisalign first, so it's just in 18 months.
Mm-hmm.
So I also did one additional aligner for him. So I think I remember I not finished in 2 years, just 1 year more than that, and then I do a additional aligner for him. Yeah. So normally
Thank.
maybe for the kids, 7 days. Some patient in case I need to jump the bike
Mm-hmm.
quickly, especially for the patient with uh the spurt nearly past or nearly past the growth spurt. Need to start early, and some patient I let them wear 5 days, but I think that's okay.
Mm-hmm.
Some from 5 to 7 days for kids.
Okay, thank you. Thank you for sharing your protocols to me and everyone. So I have another questions about the maybe about the severe crowding in children in mixed dentition because um like you say, aligner is very good at expansion. Maybe it just help a lot about the uh in the severe crowding in children. By the way, in the previous concept we have about the zero extraction. So may I ask you and maybe with the all panelists, like do you have any thoughts or experience about the difference between you expand in severe with aligner in severe crowding and with the serial extraction that we previously do for our patients just in case if the children have severe crowding. Thank you. Maybe start from Dr. Trang first.
Yeah, thank you for your questions. It also happened to me. So not all the case I expansion the arm without extraction. No, I don't say all the case. Some case also is a line expansion, but finally I also extraction. For this case, I show here because the patient have a narrow, even though they have a very severe crowding, but she have a narrow arch. So for this case, I expand the arch, expansion the arch, and we evaluate how about the bone, how about the tissue, periodontal tissues. It's okay, we can say that. But sometimes when I expand, I feel it's not because the periodontal tissue is not good. It's okay, it stop like that, and then with extraction.
Oh,
So
thank you.
not expand for all the case without extraction without extraction. Some case I have an extraction also, even though I expand the arch.
Oh, thank you. Thank you so much. Dr. Pierpont, yeah, please share your thoughts and experiences about this patient.
I think the expansion is mainly for aligners. They can expand mainly dental-alveolar, shaping, not bodily. And compared to IME, we can expand and break the sutures. So I think if you want pure expansion skeletally, you need a IME instead of aligners. My thought.
Thank you. Thank you so much. And how about you, Dr. Sawati Ashaya? Um, will you be available? I'm not sure. Maybe I just move to Dr. Jimmy first. How about your thoughts about the severe crowding in children?
Well, actually, I did not have much more cases, much more children. Most of my cases are adult. And sometimes for those severe crowding case, I agree that not to do a more extraction in young children. So I would try to no extraction way to create some space in young children. I don't do aggressive expanded device because I a little bit afraid of children. So normally I do adult patients, but I will postpone the extraction, maybe delay after the permanent dentitions. Okay, maybe getting into the all first molar or premolars that all have been robbed, and then we go through the extraction protocol, especially with those patients with profile needed the protrusive profile, the very procline incisor, then we go to extraction. So now I didn't do any serial extractions. And for those expansions device, I seldom do also because most of my case I do adult. And so this is my personal opinions. Thank you.
Thank you so much to our panelists and Dr. Trang Ho. And then we're gonna move to the next part. And Dr. Jimmy, welcome and please introduce the TAAO meeting this year to ICC audience. Thank you.
Yes, first of all, did I
I can
share?
stop. I
Right?
can stop. Yeah, I can stop.
Okay. Oh, this is the annual meeting of the TAAO from Taiwan, and I would like to very thank you for Pierre and the ICC webinar to giving me this opportunity to introduce our upcoming TAAO event. And I'm Jimmy Chai from Taiwan, and now I'm the president of the Taiwan Association of Aligner Orthodontics. And I would like to warmly invite all of you to join us the 2026 the International Symposium of Aligner Orthodontics, which will be held in Taipei, Taiwan from the next month, August 16 to 18th. The year's theme is the final mile where details meets perfections. As orthodontics, we all know that planning treatment is very important, but achieving an excellent finishing is often the most challenging part. That's why this symposium will focus on finishing strategies, detailings, and practical clinical tips can improve our everyday result. We were honored to welcome outstanding speakers from Thailand and Japan and China and also Taiwan who will share both their treatment philosophy and practical clinical experience. I would also like to give a special thank to Dr. Pierre Pong, Santi Wong. Thank you very much because he is our keynote speakers this year. It's very truly honored to have him with us on the next month in Taipei. And for our international participants, we all also have a special offer. If you register as a group of five or more, each participant will receive a 1,000 registration rebate refund during the symposium. And in additional, every registrations include a complimentary access to more than 11 exclusive online education webinar. In every month in TAO, we would have a 1 hour's webinar at around 10:13 to 11:30 in Taiwan time on Monday's night. And so if you join the symposium this year, then we can join also the following next year's online webinar. And beyond the lectures, TAO is also a wonderful opportunity to meet all the colleagues from different countries, will exchange ideas, building friendship, and learn from one another. On behalf of TAO, I warmly invite all of you to visit Taiwan this August next month. We will be delighted to welcome you to Taipei. And thank you once again for Dr. Pierre and ICC webinar for this opportunity to let me to have sharing about the event we will have next month. And looking forward to see you in Taipei and let's complete the final miles together. Thank you.
Okay, thank you, Dr. Tsai. So don't miss this meeting. And before we thank you all for joining us in for this meeting. And before we close this meeting, we have one thing to do. And Dr. Prayer and
Yeah, so everyone please kindly open the camera and we will have a beautiful photos together for the wonderful night. Oh, thank you so much for Professor Honda for joining us. Thank you, Professor Somchai and also Professor Nita and many doctor from Vietnam. Thank you so much. So please kindly open your camera and show your beautiful faces. And okay, now it's time. I'm gonna count like 1, 2, 3. Everyone just smile. And thank you again, everyone for joining these sessions, and thank you, all speakers and all panelists as well. So I'm gonna count 1, 2, 3. Smile, please. 1, 2, 3. Cheese. Again, like go to the next one. 1, 2, 3, cheese. Thank you. Just another take. 1, 2, 3, cheese. Okay, last one, last one. 1, 2, 3, cheese. Thank you so much, everyone. And thank you, Dr. Shalisu, for being a commentator tonight. You are so
You.
special. Thank you.
Thank you so much, Dr. Brown, Dr.
Yeah, thank
Shirley
you.
Chu, and uh, Dr. Shantiwan, Dr. Asaria, Dr. Jimmy Chai. Thank you. And thank you all the participants to join with us tonight. Thank you.
ครับสวัสดีครับ
Thank you 谢谢
And bye bye.
Bye
Have a
bye.
good
Have a
have
good
a good
night.
night. Have a good night.
Bye bye.